Patient 0, page 80. Round 2. Unfortunately for Mary, that wasn't the end of it. Very soon, George returned, bringing backup with him. Dr. Josephine Baker was a medical officer with the New York City Health Department. As one of the city's only female doctors, it was her job to get urine and feces samples from Mary to prove whether or not she was a typhoid carrier. As George Sofer had already discovered, it wasn't an easy assignment. When Dr. Baker and 2 burly New York policemen showed up, Mary Malone was suddenly nowhere to be found, and none of the other kitchen staff would tell them where she'd gone. Josephine and the police hunted through every closet and cupboard in the house, searching for the fugitive. They were ready to give up when the doctor noticed a bit of colored cloth caught in the closet door. It was the edge of Mary Malone's long skirt, revealing her hiding spot in a tiny cupboard under the stairs. The doctor had the police had to haul the angry, frightening woman out of the house and into the waiting ambulance. They ignored her when she shouted that she wasn't sick, that she didn't have typhoid, that she'd never had been so insulted in her life. Afterwards, Josephine remembered how the police lifted her into the ambulance, and I literally sat on her with all the way to the hospital. It was like being in a cage with a hungry lion. Fecal, blood, and urine samples taken in the hospital confirmed what George Sofer had suspected. Mary was a typhoid carrier. In early 1900s, 350,000 people in the United States became ill with typhoid every year. In New York City alone, there was more than 4,000 cases a year, and the city was trying to clean up its act and reduce the rate of infectious disease, such as typhoid. There were campaigns to clear the streets of garbage, manure, and sewage, and the city was working to establish safe drinking water supplies and sanitation for all its inhabitants. Typhoid wasn't as deadly as cholera, but it was a very serious disease. A crushing headache and fatigue were the first symptoms, followed by fever, diarrhea, and cramps. It took from 2 to 6 weeks of bed rest and medical care to recover from typhoid. A vaccine against Salmonella typhi was not developed until 1911. The antibiotics to treat the disease weren't available until 1948. In 1906, all the doctors could do was try to bring down the patient's fever, watching and waiting for the disease to run its course. When George Sofer started his investigation, no one understood exactly how typhoid spread. We now know that typhoid is caused by eating or drinking something contaminated with the bacteria Salmonella typhi. People who have typhoid shed the bacteria in their poop. Other people can be infected by drinking water contaminated with sewage or by eating food that has been handled by an infected person who hasn't washed their hands thoroughly after going to the bathroom. This kind of disease transmission is called the fecal-oral route. To fight the disease, New York health inspector had the right to march into homes where typhoid was suspected. They ordered sick people to stay home, and anyone who did not follow the order could be hauled off into a quarantine hospital. Even though Mary wasn't sick, George Sofer had proved that she was transmitting typhoid, and the city health department agreed that it would be dangerous to allow her to continue working as a cook. So Mary was sent into quarantine. in a tiny island in the middle of the New York East River. Since 1860, North Brother Island had been used to quarantine patients with dangerous, contagious diseases: smallpox, cholera, yellow fever, tuberculosis. Healthy, strong, able-bodied Mary Malone was sent to live on the desolate, windswept island, and the sick and dying as her only companions. Turn back to page 79. Tools of the trade. Putting disease under the microscope. When George Sofer barged into Mary Malone's kitchen demanding samples of her blood, urine, and feces, she must have thought he was out of his mind. In 1907, laboratory tests to identify bacteria in human bodily fluids were still very new. And the idea that a doctor could diagnose a disease by looking at a tiny blood sample under a microscope sounded ridiculous to most people. But George Sofer's unusual request showed that he was familiar with the most cutting-edge medical development of his time. 30 years earlier, the bacteria that causes typhoid, Salmonella typhi, had been identified. And in 1892, New York City had set up the country's first bacteriology laboratory to investigate threats to public health. George knew that by immersing the samples in a growing medium, often beef broth was used, and waiting 48 to 72 hours, any typhoid bacteria in her urine and feces would be visible under a microscope. Because Mary had never shown symptoms of typhoid, the new technique of bacteriology were the only way George could prove that she was the source of the Oyster Bay outbreak. Sure enough, when doctors analyzed Mary's fluid samples, they were teeming with typhoid bacteria. Turn to page 81. Dr. Josephine Baker, a public health pioneer. Mary Malone and her captor, Dr. Josephine Baker, had quite a bit in common. They were both single women struggling against the odds to make lives for themselves in New York City. Dr. Baker, or Dr. Joe, as she preferred to be called, had the advantage of an education and a medical license, but that doesn't mean she had it easy. In her first year as a doctor, she made just $185, and she had to split that with other doctors who shared her office. To earn more money, she went to work part-time as a medical inspector. That's how she ended up searching for Mary Malone. Dr. Joe made many contributions to public health during her long medical career. She was especially interested in the connection between poverty and ill health. In 1907, Dr. Joe was put in charge of the city's new Bureau of Child Hygiene, the first in the country. There, she developed programs that were later picked up in 35 other states. She made sure all children were vaccinated, that free milk was available for children from low-income families, and that people looking after young children got trained in the basics of infant care. By 1923, New York had the lowest child mortality rate of any major city in the US, thanks to Dr. Joe. Epidemiologists continue to explore the question of what makes some people healthier than others, and what policymakers and government can do to ensure that all people remain as healthy as possible.